Hello, everyone. Prashanti here. I'm lead for ethics at Sheffield. I'm going to introduce the next session. We have two speakers for the next session, and it touches on a very important aspect of the pandemic, that is the medical student experience. We have Hasnain Khan from Sheffield Medical School. He led the volunteering effect and is volunteering efforts and is president of the Medical Student Society. And we also have Miranda Clarke about her work exploring the educational impact of the pandemic. There are no opportunities for questions at the end of this, just to warn you with regard to chat messages. But Hasnain and Miranda are here for the rest of the day. You can ask to speak to them during lunch if you have questions. Thank you.
So my name is Miranda. Thank you for the introduction. We're going to start by each of us, myself then Has, we're going to introduce ourselves, touch on what we did throughout the pandemic, and then in turn we'll each talk about our learning points from that. So I'll start by introducing myself. So I'm Miranda. I'm a final year medical student in my hometown of Newcastle. And at the beginning of the pandemic, when everything was cancelled, I was in my fourth year of medical school. So for those not familiar with the structure, it's in fourth year of medical school that we go on our electives, and we also get the opportunity to choose 3 6-week placements in any specialty that we'd like. So a year, like for many of us, that didn't quite go to plan. So if I go to the next slide, we have to plan to do a clinical genetics placement at Great Ormond Street for 6 weeks. My elective was going to be in half of it in South Africa at the Mozambique border, and then half of it was going to be in looking at working in a lab that researches gene therapy for cystic fibrosis. So much like the rest of us, that didn't quite go to plan. And although I was disappointed, I think arguably I've learned far more from my various roles that I've had throughout the pandemic. And that's why Brian asked me to speak today. So in his words, not mine, he kind of wanted me to demonstrate the impressive flexibility and initiative that medical students can show when we're left to our own devices, and sometimes potentially learning more from that than what was our timetable curriculum. So briefly what my role was. First and foremost, I was already a healthcare assistant within the Newcastle Hospitals Trust, but I immediately went full-time when medical school was cancelled. So this was predominantly in the cancer unit in the Freeman Hospital, but I also picked up additional ad hoc shifts at weekends and things on COVID wards or wherever was kind of needed. So I was fully integrated into the Northern Centre for Cancer Care team, and I built very strong relationships with other healthcare assistants, nurses, doctors, kind of offering practical and emotional support to members of the team where I felt I was able to. Secondly, I am a first responder with the ambulance service. So this is a voluntary role. We work in pairs with a dedicated vehicle, and we respond to category 1 and 2 999 calls. And lastly, this is more recently, I was talking to a local GP about the struggles of staffing the vaccination centres. So aiming to vaccinate 1,200 people in any one day kind of requires removing qualified staff from their daily roles and their important roles to staff the centres. So we worked together to work out what medical students would need to do to be legally involved in staffing the service. And I managed to recruit 35 students, although there are plenty more in the waiting list, to support the vaccination service. So, for example, well, this picture actually shows me and one of my best friends, and actually we were able to vaccinate each other, which was a pretty powerful thing to happen. But also I personally vaccinated 66 people on Saturday, which was a privilege and quite a humbling experience. People were pretty emotional on the day, and kind of seeing it as, I guess, the start of hopefully moving upwards. But yeah, anyway, over to Has to introduce himself.
Hello, everyone. Before I start, I just want to thank the IME committee for inviting me today, and Dr. Vivekananda Smith for inviting me. So yes, my name is Hasnain. I'm a third-year medical student at the University of Sheffield. I'm the president of the Sheffield Medical Society. We're the largest society at the university, where I'm the lead voice for the 1,500 Sheffield medical students. This summer, while I was intercalating, MedSoc, we created a South Yorkshire COVID-19 volunteer scheme where we had students volunteering in hospitals, GPs, community centres, hospices, and babysitting services. And with the efforts that myself and my team in providing the volunteer scheme, helping our healthcare services, but then also adjusting to the curriculum changes, giving input to the medical school. I was honoured to be mentioned in the Queen's Birthdays Honours List this year, and awarded a British Empire Medal. So I think the second part of our talk that we're going to do is going a little bit more detail about what we actually did and how it was for us, and then also our learning experiences as students. So I'll hand it back to Miranda.
Thank you. Yeah, so we'll start with my experience. So I guess from day one of medical school, we've been taught to think about every patient, every presenting complaint, and every treatment option in a holistic way using the biopsychosocial model. So I thought it would be interesting and a useful way to structure my learning from my roles today. And I just wanted to say that back on the wards now full time in my capacity as a medical student, I'm still finding out how much I've actually learned in the last 9 months, potentially without realizing it. So I'll start with biological. So there's been lots and lots of practical skills. So taking bloods, ECGs, starting to be able to recognize a deteriorating patient for myself, putting patients on oxygen at home as part of the first responders scheme, and managing airways and things as well in the community. I think through medical school, everybody's always been emphasizing to us the importance of learning on the ward and learning practically and not just escaping to the library and opening a textbook. And I think that my roles really emphasized that for me. So particularly as the healthcare, I'd spent the first half of fourth year learning about oncological emergencies and presentations in the cancer setting. Things like malignant core compression, neutropenic sepsis, coffee ground emesis, graft versus host disease, and also grade 3 and 4 pressure sores. Now the list goes on, but actually seeing these presentations was extremely powerful for not only reinforcing my learning, but also to see them from the nursing side and actually just to see at the heart of it, the frightened patient in front of me, and actually the impact that any one of these things does have on the patient and the team as well. And that's kind of what I mean by bringing the textbook to life. Also, which we were very lucky, there was a couple of us who were medical students who coincidentally ended up working there together. And actually, one of the consultants found out we were medical students and decided to do lunchtime teaching for us. And the nurses rallied round to ensure that we could have lunch at the right times for that to happen, which we were very appreciative of. And actually that led to us using free time in the evenings and weekends, not that we had very much, to get involved with audits, posters, and a paper. So I've just kind of put those on the bottom there so you can get an idea of that. But also for me, the social side of it. So throughout medical school as well, I have found that we associate mainly with other medical students and doctors all the way through. And then actually suddenly we're out in the hospitals and we go on to spend the rest of our careers working in larger multidisciplinary teams without always having had much exposure to other team members. And while I've witnessed amazing examples of MDTs working cohesively and supporting each other, and that I will do my best to emulate that in my future career, I've also witnessed relationship breakdown between professionals because of a breakdown of communication, perhaps because of a lack of understanding about the competing priorities that different staff members face at any one time, despite everybody having the patient at the center of it. So I think having had the opportunity to walk in the shoes of other members of the MDT, including members of the nursing team, kind of paramedics with my role as a first responder, and also as a medical secretary prior to medicine, has been hugely beneficial for me, and I hope will help me see later as a doctor, what is a reasonable request? Why has someone reacted in a certain way to my request? Am I asking the right person for help with that? And these kind of things. I talk about the ward structure because actually that's something I've noticed this week was actually on the ward with fellow medical students who actually didn't know what being a sister on a ward meant, a nursing sister or a matron, and actually the structure of the ward. So I feel quite lucky that I kind of got to understand that without potentially realizing again from working as a healthcare assistant. I also wanted to touch on relationship with patients, which has been really huge for me. I genuinely cared deeply for a lot of the patients that formed relationships throughout the time we're working in the cancer centre. There were a lot of patients who I'd see 2 to 3 times a week in the outpatient department, and I was able to offer support and a listening ear to them in a time when many of them were shielding and many living alone, and where actually their only social interaction was coming into hospital. It was very humbling and a pleasure to have been there for the patients in however small a way that might have been. And I think it also taught me a lot about my own resilience. So that's not to say there weren't tears at times, but when patients who had formed strong relationships, had been told that they'd relapsed or deteriorated or potentially even died while I was working there, it was really hard, but I kind of taught myself that I can be resilient, and I am resilient, and it will be okay being a doctor. Conflict resolution, I'm conscious of time, but I know for many it is an e-learning topic, and we have to constantly redo it. But actually, the tensions and anxieties were so high through the pandemic, and to be able to see at the heart of that, as I mentioned before, a kind of frightened patient and keep that in mind was a huge learning curve. I won't go into the specifics of the situation I'm talking about, but yeah, that was really important as well. And also, again, it's such a privilege in my role as a first responder to go into the homes of patients when they're at their most vulnerable. I think medicine in the community and medicine in the hospital is very different. And it has allowed me to, going back to the MDT thing, allowed me to appreciate the challenges that paramedics do face on a daily basis in getting patients from home and into the community. I'll go on to kind of the psychological side of that biopsychosocial model. And just to say really that the support and friendship was huge throughout that time. And I hope that I was able to offer support and friendship to many of my team I was working with throughout that time. And it has really done a lot for my self-esteem and confidence and resilience, as I said. I think I can be self-critical, and I think I do worry about imposter syndrome, which I've highlighted in red because I'm hoping that won't be there when I do qualify, if all goes to plan in June. But yeah, it's taught me so much about myself, and I hope that I will be a better doctor in the future because of it, and will be able to work well in an MDT and try and be not only empathetic to patients, but also empathetic to colleagues, and really trying to appraise situations more roundly to understand where anyone's coming from at any one time. So thank you very much for listening. I'm going to pass over to Haz to talk about his learning points.
Thank you, Miranda. Yes, so I'll just go into a bit more detail about me, where I'm from, and then what I've learned during this pandemic. I may be saying next slide because Miranda's got in control of our PowerPoint. So next slide, please, Miranda. So just a little bit about the body that I'm actually from. So as many of us on this call who are either medical students or doctors, our course is very unique compared to other university courses. Medical students spend between 4 to 6 years at university. Integrated into our course, we have placements, our timetables, our exams are at different times. And because of the uniqueness of it, medical students felt they needed to create their own experience, their own learning experience or social experience for their time at university, of which the student union may not be able to offer. So the first medical society was created in 1737, the Royal Medical Society, that's Edinburgh. Sheffield's not that old, we're just over 200 years old. And at each of the universities, they are one of the biggest societies there because the medical degree, you have a very large intake of students. So at Sheffield, we're the largest at the University of Sheffield, and myself and our committee, we represent the 1,500 medical students. Next slide, please. So here's the things that we actually do. As MedSoc, we are the student representative body that represents all the students, caters for their interest. You can see in the top left, that's our annual board that we do every year. We've done it for 193 years now. We run large academic events where we have hundreds of students attend, whether that's OSCE exams or written-based exams. We do charity events where I ran one 2 years ago where we had over 100 players coming, staff and students playing football together. But then a big thing about MedSoc is we actually have sub-societies, kind of like the Student Union, which are there if you have an academic interest, such as neuro society, sports and exercise medicine. We've got sports because we find our timetables are very different to other university courses, or those just people with other interests like our drama society, medics, choir, and other such things. Next slide, Miranda. So how do we achieve this? So over 200 years, we've formed a very large committee to be able to offer all these services to our very big membership. With varying experiences. So we have junior members who are split into representatives and then officers. So representatives, those who put the voice for those students. So we've got year reps, we've got 5-year reps, we've got a population of postgraduate students and international students. But then we have officers as well. So those people who need services, MedSoc to provide services for them, whether that's academic or welfare, or people who run our society, like our publicity and technology officer. Our executive committee, they are people made up of students who've served on MedSoc for 1 year. So whilst we do encourage new people to come, we do actually need that experience to be able to run all these big events that we do each year. And then the president, which is the role that I've taken on, is normally someone who has served 2 years on committee. So myself, I was sports secretary, a junior member, then I moved to the executive as secretary, and then elected president in March, April time. Next slide, please, Miranda. So what have I done this summer? I started my role in March, and the same evening I had a meeting with the dean of our medical school about the challenges that are about to come up. And I think it was a few days before we went into a national lockdown. As MedSoc, we received a number of messages and emails from our members, from medical students who felt they had a sense of responsibility to help out and step up during this pandemic. From there, we set up our volunteer scheme where, as I said, we had 400 students helping out across all NHS services in South Yorkshire. Just to highlight that, our scheme is called Sheffield Medical Students Helping Hands. Helping Hands is actually a national group where each of the MedSocs or medical students at each of the medical schools are running their own schemes to coordinate students to help out in hospitals or GPs or babysitting services for NHS staff. After that initial stage, when we then went back onto placements, students still wanted to help out. Some students wanted to continue to play their part during the pandemic. So right now we're helping and had been helping with vaccine trials, supporting the track and trace system. And then right now, hopefully we're in the final stage, getting students to help distribute the vaccine to get us out of the pandemic. Next slide, please. So what did I learn, or what did the people around me learn during the pandemic? So the role of MedSocs, as I hopefully have explained, that we're quite established bodies at medical schools, at university. We're very known between the different bodies. We found there was a change in our focus this year. Normally our focus each year is running socials or running academic events, but we actually found this year there was more focus on the welfare side. So my welfare reps helped, we all ran the volunteer scheme together. We also felt there was a focus more to make sure that we actually reach out and engage with each of our students, because we understand the pandemic can have challenges on students, on themselves or their families, and that can have an impact on their studies. We also found the relationship between the medical society and the different bodies in which we interact with. With the medical school, my role is to have a relationship with the dean of the medical school, and I found I was getting in contact with her a lot about national guideline changes or curriculum changes all the time. We would end up phone calling each other on the weekends, which I found a very bizarre experience as a medical student, being in contact with the dean of the medical school. Relationship with the hospitals and GPs, we don't normally get in contact with them. If you need to speak to them, we normally go through to the medical school and then them, but we actually found people were getting in touch with us because they could see us, how we were running our scheme on social media, on our website. They were coming to us asking for help. Our relationship with the members had changed. As I said, our focus had changed more towards welfare, and they wanted us to step up and play our role during this pandemic. Next slide, please. Role of medical students, as Miranda did highlight, there was a change when you're on placement. Are you there to support the NHS staff, support the frontline workers, or are you actually there to complete your competency, complete the skills of teaching needed to complete your role and sign off the skills that you need as a doctor? Next slide, Miranda. And then finally, role of myself. As I never expect, I did choose to be the MedSoc president, but I never expected the circumstances that we were in. And it was a challenging experience to manage myself running the volunteer scheme, even though, yes, I had been elected, but not received any formal training. And I'm incredible for the support that the medical school gave, my committee had given me to make sure that we could respond to it, not just the volunteer scheme, but also dealing with the welfare concerns or any issues students had during the pandemic. But then also my role as a medical student, I'm also there to complete my degree to finish my time at medical school. So that's the end of our talk. I understand we're not taking questions now, but if people have questions, I'm sure me and Miranda will be here in the lunch break. I guess if you had any more questions about the logistics or students, logistics of how we ran our scheme or coordinating medical students, I'm probably the best person to ask. If it's more frontline care, I think Miranda will be in a better position than me to answer that. Thank you.
Yeah,
Thank you so much. Really powerful presentations. It's obviously had amazing impact, both positive and challenging impact on your professional identities, I bet. If you look on we are now going to break for lunch until 1:45. It's a shortish lunch break. In case you're expecting drones to fly over with catering, you are making your own lunches, I think. If you look on your chat box just above, there is a blue box that says everyone. If you press on the drop down box, you can directly message Phil or anyone, but directly message Phil if you would like to be put into breakout rooms. And some really interesting comments about your presentation, guys. So please have a look, especially Suzanne's. Thank you.